Gauteng Health MEC Bandile Masuku. Thanks very much, Griselda, for joining us. Just give us a summary of what the MEC had to say.
Yeah. A very good afternoon to you, Nompu. Well, as you can see here, just next to me, the makeshift hospital that has, of course, been spearheaded by the Gauteng provincial government, the health department, of course. For any eventuality, you would know that the Gauteng province does have the highest number of infections. It is the epicentre of the outbreak of the coronavirus in the country. And, of course, in Gauteng, Johannesburg being that epicentre. And the last numbers that we saw was about 890 people infected with the virus. We know that the province is the third highest in terms of the number of deaths. So you would see here just towards my right, this is where about 500 beds will be accommodated at this stage. And at this point, Nompu, it's basically for quarantine and isolation. But in a briefing just a few moments ago by the Gauteng Health MEC, Dr Bandile Masuku, he did say that if needs be, you would also have beds at a later stage which would accommodate those who would need ICU. So at this point, this is what it looks like. We understand that it will be fully ready in about a couple of days' time. So these are some of the measures that the Gauteng provincial government, in particular the health department, has put in place to make sure that it is able to deal with whatever may occur in the province, specifically because we're talking about it being the epicentre of the coronavirus outbreak in the country. Without wasting time, let me join the MEC. Take place.
Yes, I think we are, like we've been saying, and we are moving accordingly in terms of our response and the situation that we are in. And currently we are planning for, the eventuality that most of you saw on the TV yesterday, presented by Professor Karim. But the important thing is that it's better for us to be over-prepared than to be under-prepared. So we are going to put up all these facilities across the province. This one will be the first, and the phase, like we said, the phase one will just to do the 500 beds for quarantine and isolation, with the ability to escalate to almost a bigger scale. The facility itself can be able to cater 2,300 beds, and also in terms of the other transitional temporary structures, we can be able to move towards 5,000. So we are working towards it. We are working closely with them to be creative and also not to ramp up the cost, just to do them in the most reasonable cost.
What is the projection? I know we were listening to Professor Karim last night in where South Africa looks in terms of flattening that curve. What are we anticipating specifically for this particular province? If you look at, for example, where Gauteng has been since the first case had been detected in South Africa, of course the province being the epicentre of the virus in the country.
I think the outcomes of the lockdown has been quite good. I think we tried to understand what could have contributed for us to have a steady increase instead of the exponential increase. And we are happy that the lockdown has given us a better chance, in terms of closing out borders. When I talk about borders, I talk about OR Tambo, and I also talk about the interprovincial borders. And just on its own, just the regulations themselves are quite important. So we are hoping that some of the restrictions will continue to a later part of just to pass through the winter as Gauteng, and I think those measures will still continue to help us to lower the curve. And I think if you look at the curve recently, you will see that it's starting to show that flattening that we have been talking about.
I also asked a bit earlier on in terms of healthcare professionals, of course, who would need to be here to assess some of the patients who will be brought here. You did indicate that you've been flooded with quite a number of requests for those who want to assist within this particular sector.
Yes, we are going to put up a link for the people to enroll in the link to just avail themselves. Other individuals have already started. I think I spoke about the nurse in Alexander who works in England. And I think this is what we actually appreciate. But the other thing is that because we are in a national state of disaster, all the doctors and all the health professionals, whether they work in private or in public, they are now ready, and they should be trained and be ready and be alert all the time for when we need them. We're going to call them in to respond to the patients with COVID-19.
MEC, thank you very much indeed for your time. I'm going to ask you to please move towards this direction. Thank you very much. We'll just bring you a bit closer here. I'm just going to ask my colleague Tula Morare to come towards this direction. In fact, he is there. You'll see basically here, I'm hoping you'd be able to zoom thus far. These are the beds that have been set up here. It's not complete at this stage. We're expecting in the next few days you will see everything quite more covered here. Some of the plugs that you have here, I understand that there might be a central television set that might be somewhere there. I kind of heard something along those lines here. I've actually gotten a nod, Nompo, pertaining to that. Indeed, that will be the case. So this is, the area that has been set up basically for where the patients will be brought in. Just to clarify once again, this, of course, would be the quarantine area. The quarantine area where, of course, if there are, a suspected case, this is where you will then be kept for that quarantine period. And then the isolation area is on the other side towards that direction, where you also have an emergency button that you're also able to press in the event that you do need some assistance. So here at the moment, 500 beds that will be accommodated here, but could move to about 2,200. That is the maximum that they're talking about. So currently for quarantine and isolation, but the MEC indicating that a possibility also of the fact that they could also add for ICU patients, Nompo.
Thanks very much, Griselda, for that feedback.